Hello! Welcome to the Catholic Everywoman, where we have conversations about how normal people live the Catholic faith.
I'm Jane Spencer.
And I'm Anna Sutton.
And today we are talking about why so many Catholics are suspicious of medicine. Anna.
So suspicious. Okay, so we'll go into our backgrounds. I am married to a physician. My dad is also a physician. So I always say I've been on the outside of the medical world my entire life. So I've really seen it from every angle because most of our family friends growing up are in the medical family. A lot of our friends now are in the medical world. So I've really seen it from every aspect except, literally being a doctor or a nurse. My mom was actually a nurse as well. So I feel very strongly about medicine. I'm probably naturally programmed a bit to trust doctors because with my dad being one and then marrying one, it was like I'm inclined to think the best of doctors. And I've been surprised since my conversion 5 years ago how that's really not necessarily the norm in the Catholic world at all. It's often the opposite, I would say. And this is true in a lot of areas, especially since COVID. I mean, COVID kind of ruined the world a little bit, but it definitely ruined people's feelings about the medical.
Yeah, for sure. I think it decreased trust almost universally.
Yeah.
For me and my background with the medical world, I have an aunt and an uncle who are both physicians and they're married. I have an aunt who's a nurse. She's has her master's in nursing. I have another aunt who is an occupational therapist. And then I myself wanted to be a doctor growing up.
Congratulations escaping that.
Whew. Well, I finished my pre-medicine degree for undergrad, and it was extremely rigorous, but I decided in the end that that was not my path.
So, what made you decide that?
I think over time, as we started getting really close to graduation and everyone was studying for the MCAT and touring medical schools and figuring out where we wanted to apply, I think the medical bureaucracy kind of came out of the woodwork. I would hear about doctors who had to pay a fee if they didn't check the box that they talked to their patient about smoking cessation. Mm-hmm. Things like that. Malpractice suits, family life also.
Oh, yeah.
The balance of what family life might look like was a little bit intimidating for me. So with all of that, I think I was also burnt out from so much chemistry. And
you hadn't even started medical school yet.
Yeah. So I ended up taking a break and then going in a different direction.
And now you are?
A psychologist.
There you go. So still medical.
Yeah. Just taking care of the mind instead of the body. But the body and the mind are also so integrated. I just don't use pharmaceutical intervention.
Yeah. Well, and now doing this, you're also taking care of the soul. So you're a really well-rounded practitioner, actually.
Yeah, just doing my best.
Yeah, so I think we should say before launching into frustrations about it is I fully admit there are so many problems in the medical system. I have been a patient, and sometimes, recently one of our kids had to go into the emergency room in the middle of the night because croup. Our kids all get croup. They all have weak lungs. And my husband took him, and he came home, and he was so frustrated. And he's like, it's good for me to remember that by the time, because he's a specialist in gastroenterology, so by the time patients get to him, they've already been through so much rigmarole, and it is really frustrating. And you can definitely just start to feel like nobody listens to anything you say. You have to repeat yourself 700 times. Mm-hmm. People treat you like you're an idiot. He didn't mention to them he was a doctor, and he's like, they talked to me like I was the most unintelligent person. Wow. That's their kind of baseline, especially in the ER. Nobody likes ER doctors. Even other doctors don't.
And I also understand from a professional perspective not to be too jargony when we talk to people. If I'm using big clinical terms, that does go over some people's heads, and they remind me, they're like, what does that mean? And then that's my fault that I spoke to them like that. So
somebody knows exactly what it is, and they're like, why are you dumbing this down so much for me?
Yeah. It's hard to know exactly who your patient is.
Yeah.
But that's cool that he went there and he didn't say anything and just observed.
Yeah, he's very humble. I always say I'm married to a doctor so that they know that I'm not a dummy. I have a friend who she has a chronic health issue, and so she goes in a lot. And she says she always brings a really thick classic book so that they look at her and they just assume she's smart. So I've done that before. If I have to go in, like if I've been pregnant and had to go in the ER, I'm like, grab a book. And so they'll look and be like, she reads.
So you're kind of intelligence signaling
Exactly.
a little bit.
I'm like, look, I brought the Odyssey with me. I've never read it, but I could.
Yeah, and it's not even in English.
Yeah, that's true. So fully admit, and like what you talked about with not going into medicine because the amount practitioners have to jump through hoops, that is actually like completely accurate. Like, it is really frustrating for doctors how much paperwork they have to do and how much is just really you're jumping through hoops for insurance. You have to be able to bill a certain way.
100%. Insurance really guides treatment, and maybe guides is too nice of a word.
Yeah.
Insurance gatekeeps
They
treatment.
are, I think insurance is the devil.
So
insurance is the real problem with the medical system.
Down with insurance.
Not that you should murder them on the streets, though. That we do not support.
Right, because that happened.
Yeah, and so many people were happy about it. Like, that's how angry people are about the medical system.
Yeah, I mean, people have died due to unpaid claims or unaccepted claims.
Oh, yeah. Yeah. The other aspect of being a doctor that's frustrating from the flip side is people are really lawsuit happy. People threaten to sue all the time. They're constantly. So there's like this mutual frustration of like, insurance makes it hard for everyone, and then patients are frustrated, and so they are like ready to snap at their doctor. The doctor's kind of burnt out because they're also in this broken system, and doctor burnout rates are insane. Doctor suicide rates are insane.
Really?
Yeah, and I mean, you like a lot of these people. If you're going in, your doctor might be on like a 24-hour shift. Like you might be dealing with someone who's completely overworked and overtired.
I thought that was illegal nowadays.
No. Actually, so when my husband was in residency, they did a trial where like multiple residency programs in the country had limited hours and multiple didn't. We did not have limited hours. And the outcome was patient care didn't change at all. The only thing that changed was the doctor's like mental health. So they're like, we don't need to do that. So the regulations didn't change at all, which is stupid.
Yeah. Okay. So we're both coming from a perspective of experience. People we've known and loved are medical professionals.
Yeah. And I would say our default is to trust the medical system. I mean, trust the science. I hate to say that. Oh.
Well, I mean, you're not wrong.
Yeah.
Right? I mean, the study of biology, chemistry, biochemistry. Yeah. We have to study that to know what works.
I believe that it matters to have an expert who knows what they're talking about.
Absolutely.
Okay.
Yeah.
And I think that's where a lot of people genuinely don't believe that that's important.
Wow. Okay. So when was your first encounter with Catholics not trusting the medical field?
Oh, my goodness. Well, okay. I grew up in Colorado. So nobody in Colorado, everyone's pretty crunchy. And then when we moved away from there, things were more balanced. And then when I became Catholic, I realized quickly, like, oh, we are thick in the, like, naturopathic, crunchy world again. Where there's, like, almost an obsession with health.
I agree. Yeah, you're right. I mean, so many people, especially women, that I talk to are just always sick, or they're always taking their own temperature of, like, well, how's my stomach? Oh, I had a little bit of a fever, and so I'm drawing these random conclusions about, well, it's because I didn't have enough fermented food, or I ate a tablespoon of processed sugar yesterday, and I'm just like,
it's the gluten.
Yeah. Oh gosh, the gluten, the dairy, the horror. So
any processed food. I know. I'm always saying, if you are this sensitive to foods, you're sick. Like a healthy person doesn't have to alter everything in their diet to feel good. Like, it's not healthy to be obsessed with how you feel.
I agree, because then you're constantly looking at yourself and then making small changes based on your own opinions or based on the internet.
The internet. Oh, I know. The Googling, the self-diagnosis on Google. And then what Andy encounters all the time is people who diagnose themselves on Google, and then they come in and they want to tell him their diagnosis and then expect him to treat it the way they think it should be treated.
Right. And that is so insulting.
Well, and it's just like, he's like, I can't do that. I'm like, it's illegal. Like, I'm not going to treat something I don't think you have, you know?
Yeah, absolutely. Absolutely. And I come across this as well in the psychological field, where I might give people suggestions on like, okay, this is what you need to be doing every day to heal, you know, especially with depression. It's very behavioral. So I'm saying these are the behaviors, the observable ways you need to move your body and treat your body so that we come out of this depression hole. And they're like, well, I ChatGPT'd what you said, and they came up with these other ideas. But ChatGPT is not holding anyone accountable. And ChatGPT also, this is another internet thing, which your husband probably understands, but ChatGPT and the internet is broad and general. Individuals are unique.
Yeah,
and what an individual needs based on their whole history, their symptomology, is very specific. And so trusting ChatGPT or WebMD, whatever, it might not apply to them. And then, if your husband or myself were to say, just go for it. Do whatever ChatGPT tells you to do, that would be unethical.
Yeah, and you could get sued like crazy.
Yeah, I also have to pay malpractice insurance as a psychologist, believe it or not.
Yeah, of course. I mean, you have to pay it. Here in the state of Missouri, you guys are in Missouri, right? You can sue a doctor, this is still the law, for everything except a chicken and a couple of goats.
What?
That's why, like, I know it's like, wow, we have not updated this in a long time. Most doctors choose to live on the Kansas side in Kansas City because the lawsuits, like the malpractice laws are better over there. So we pay higher malpractice insurance because of that. I
am licensed in the state of Kansas, even though I live on the Missouri side because it's prettier.
It is prettier, but they will, if it goes to court, they will sue you, even if you just live there and you don't practice there, they'll still sue you as a Missouri.
Really?
Yeah.
That's wild.
The lawyers will do anything to make it a Missouri lawsuit instead of a Kansas lawsuit.
Wow. Incredible.
But it's crazy. Okay, so I think we should talk about why is it that Catholics in particular, or devout Christians in particular, are prone to not trust medicine? Because we actually touched on this in our last episode too. There's something about saying like putting faith in God above an institution.
Yeah.
That I think they perceive to be as like a holier way of life.
Yeah. I think that imbalance is where it's at, right? So if there's something wrong with me, body, mind, whatever it might be, and I'm a Catholic, well, God is almighty. And if I pray, and if I maybe say a novena to a saint that I'm devoted to for healing, or if I pray more and I focus on my spiritual life, then all will be well.
Yeah.
So I think there's that side. And then also, especially as Catholics, we view suffering as valuable.
Yeah.
Right? And so if someone is suffering physically or mentally, and they're offering it up, for whatever intentions they have, then they go to a doctor. Is that throwing off the cross? Is that throwing off what they're supposed to be doing?
Yeah, like taking an easy way out, not leaning into what God has given you.
Am I trusting Dr. Sutton over God? And how far do I trust Dr. Sutton?
Not further than Google, apparently.
Right. If Google disagrees with a professional, it's amazing how many people will trust Google first.
Yeah, because they feel they have control over Google. They're like, I don't know anything about this doctor. The other thing in the faith world, there are things that are really unethical and directly against church teaching that happen in the medical world. Obviously, abortion, assisted suicide, where it's like, can we trust a person? Like, I know people who truly, genuinely believe that OB/GYN doctors are like actively evil. Like, they want your baby to die, which is a massive overstatement of an entire profession of people.
Well, it's first of all against the Socratic Oath.
Yeah. And also they just wouldn't have a job if all their babies died.
Absolutely. Yeah, no, I hear from women like, well, if I have a C-section, the doctor will cauterize my tubes without my consent.
Yeah, it's not going to happen.
And then for me, as a not mom, that's horrifying to hear. And then I have this fear of, if I have a C-section and I'm, I can't see anything and I'm obviously very vulnerable, what if my tubes get tied?
Yeah.
Oh, okay, does this mean that I need to avoid a C-section at all costs? Or how far do I take that? Does that mean I need to have a home birth so that no matter what, I'm trusting this midwife that no matter what, I won't have a C-section, unless she says this is an emergency, we have to go to the hospital. So is it just all about feeling safe, or like to your point, feeling in control?
I think a lot of it's about feeling in control. And if something seems suspicious, it's easier to just not do it. Like vaccines are a great example of this. I'm one of the most vaccine pro people I know. My dad did peds intensive care, and so my whole life I heard him get angry over and over again about these children who died over things they could have been vaccinated against. He was so passionate about it.
Like what?
Oh, I mean, like measles, mumps, rubella, whooping cough, like all the things. These are the very basic vaccines that most kids get, and babies in particular are super susceptible to them. And some of them you can't get right away. But so that was something that just growing up, it was like deeply grounded in me. So I would say I have more trust in vaccines than the average person. And even I have heard enough negative things about vaccines that there's like still a part of me when I go to take my baby for their first round of shots that I'm like, ugh. Hopefully they don't have autism, which I know is completely proven false and not real. But the fear is strong. It's easy to make decisions based in fear.
Fear is a great way to manipulate. So even if something is completely good, if we instill fear, then even you have that apprehension, I'm curious about, since your dad especially worked with young kids, what kind of arguments or even faith-based arguments were against things like vaccines or treatment?
I mean, I think people who don't vaccinate mostly genuinely believe there's a greater risk of harm than good. And it does come back to they don't really trust a system. They don't really trust the research. They don't really trust the experts behind them to think that they're telling the truth. And there's so much false information. We just have access to so much information. And so it seems less risky to just choose not to vaccinate and trust that your child won't be exposed to things. I mean, there was I know of a family at our church that had whooping cough a few weeks ago. And it's what if they didn't know it was whooping cough? They didn't know that it was really interesting. She actually told me, she said, the first half of my children are vaccinated. They did not get whooping cough. The second half are not, and they all got it. And so she's like, I'm going to vaccinate the rest of my kids. It worked. But also, I was thinking, oh my goodness, how many newborns are in this building right now? We have tons of families at our church and constant babies being born. So I'm like, if you just don't know and you bring that into the church, a child could die. They could actually die from it. And I'm not blaming this person at all. She had, you don't know. You don't know what you don't know. You don't know the diagnosis if you don't know it. But
right. And I think when people look online for, hey, vaccines, they're going to find the clickbait. There's a huge negative bias to this kind of thing if you know where to look.
Oh, yeah.
And that's really interesting to look at. Don't do this because my personal experience, right?
Yeah.
And, looking at medical journals is boring. But clickbait against vaccines in the crunchy world is exciting, and we can feel empowered by having that control and having the ability to say no.
Yeah. Well, and during COVID, which I think did a huge amount of damage to medical professionals and the trust in the medical system, the medical system was against religion in some ways, in the sense we had outside people telling us we needed to not have church and not gather and not go to mass and that kind of thing, where you're I'm sorry, this is not your prerogative. You don't get to you don't get to interrupt people's faith practice. So I think that definitely people who were a little bit at odds pushed them even further to like, okay, no, these people are actively against our religious freedoms. And there is pressure. Like, if you don't stand up for yourself in a medical setting, you can be pressured into things you're like kind of on the fence about. And so people feel scared of that.
Yeah, I mean, to that point, a friend of mine had one of her children vaccinated just according to the normal schedule. And he had a lot of side effects, like got sick for weeks, lost a lot of weight. So he had a lot of side effects. And she went to her pediatrician, who was a female, and she said, hey, I'm just wondering how we can look at vaccines in reference to how sick my baby got and the fact that he's just lost so much weight and he's not thriving. He's like, I think less than 1 year old, and he's not thriving. Can we talk about like spacing out the vaccine schedule? Can we have a conversation? And she said the pediatrician was really defensive immediately and left the room, came back with a piece of paper, like a document that said, if you don't sign this, you're fired. And it was to sign a document stating that you will conform to the vaccine schedule that's posted.
Yeah.
And so for my friend, that really hurt. And that was really shocking to her, first of all, that the doctor wouldn't listen.
Yeah.
And that there was no flexibility. She wasn't saying, I don't want to vaccinate, but she was saying, my kid is really sick. And could it be as a result of so many vaccines at the same time that he just, for some reason, is having a really hard time with the side effects?
Yeah. I mean, obviously that doctor was burned out and totally fed up. This happened a lot. Like,
well, my friend...
It's not a good choice. It's not good medical care.
Okay, and then the end of the story is my friend has had, I think, 2 more kids and is completely anti-vax now.
Oh, yeah, so she turned her off all the way.
Yep.
That's frustrating. Yeah, my pediatrician, it's funny, I've never felt pressured by a doctor to do something I didn't want to do.
Have there been things that you didn't want to do?
Yeah, like my doctor, when I had the twins, I really, really didn't want to go to C-section. I ended up having a breech delivery. And, yeah, my second was breech. And I talked to a lot of different doctors about it. Because in the practice I saw like several in that practice. And I did really push to deliver because I had to be induced when I knew that a doctor was on call that was more likely to do a breech delivery. In the moment, I wouldn't have absolutely said no to a C-section if the doctor wanted to do it, though. Because if a doctor is not comfortable doing a breech delivery, I don't want them to do it. Like, if it's safer, if you're not well-trained in that, or haven't seen it a lot, like you're a younger doctor and you feel more comfortable doing a C-section, like by all means, cut me open, Okay. But that comes down to kind of trusting what the doctor says in an emergency moment.
Yeah.
Where I did all the buildup, like we, talking about this is why I think I'm a good candidate for a breech delivery. I would really prefer this. Like, let's talk about it. But in the heat of an emergency, you do kind of have to default to the expert in the room because you don't really know.
Yeah, absolutely.
And I didn't give my kids the COVID vaccination. So that was something doctors brought up and I was just like, no. And they're like, okay.
Okay.
Like, it wasn't, I didn't feel that children were at risk from COVID. I only got one, and that was because I was having a baby in a hospital and I didn't want to deal with it. So I was like, whatever, I'll get it. But I feel like for the most part, like you hear these horror stories, but for the most part, doctors are not like that. Like most doctors want their patients to be happy and healthy and well taken care of. Maybe you catch them on a bad day, but like telling bad stories after bad stories makes it start to feel like everyone's this way. And that's just not true. Most people become a doctor because they care and they want to do something good.
Right. And becoming a doctor is a full-time vocation.
No, it's horribly difficult.
Yeah. The amount of studying, the years and years of studying, really, really hard things, right? Because you need a weed out process. If you are responsible for people's lives, you have to be very intelligent and you have to be able to persevere through a lot of hardship.
Yeah.
And then as you know, with your husband being a specialist, all of the board exams and certifications and responsibility, it's huge. The path there is so long.
It's really long. It's really rigorous. It's a ton of testing. And every doctor has to re-board certify every so often. So they have to stay on top of, you're like every 10 years or something.
Wow, I didn't know that.
It depends on the specialty, like how often you have to do it. I think some are 5. But I don't think people have any idea how unbelievably rigorous and difficult it is to reach a point in medicine where especially if you're specialized, but even like a family practice doctor, you go through all of college, you have to qualify to get into medical school. Yep. You do the test, you get into medical school, you have to do medical school, and then you have to do a residency, and you have to pass the board exams, and you have to match into the programs. Like it's thing after thing after thing. And then you have person after person come into your office and like, I looked this up on Google, and you're like, shut up. Yeah. I mean, it's frustrating.
Yeah.
You know?
So it makes sense why doctors would just be fed up with these narratives and these people who think that Google knows more than they do.
Oh yeah.
And they've put their blood, sweat, and tears into learning all of this.
Well, and the workload is massive. So, okay, you have a patient that's not listening and doesn't want to, like, okay, then get out. I don't care. I have 15 other patients to see.
Who are willing.
Yeah. Who are really sick. Like, fine, take your child to some naturopath. I don't care, you know?
Yeah, no, and I see that as well a little bit with psychology. People coming to me and immediately attacking me, saying things like, well, I want you to know right away that I am not willing to medicate my child, or I'm not willing to engage with any pharmaceuticals whatsoever. And it's I don't know, I find it kind of insulting.
Yeah.
And also, I guess they don't know that psychologists don't prescribe medication.
You're like, safe.
Yeah. I'm not an MD who did a residency in psychiatry. Yeah. Therefore, I do not prescribe medications. So there's that. And then also, let's see, what's another one? Medication. Oh, so if I suggest anything like mindfulness or breathing techniques, I've been attacked with people saying, does this go against the teachings of the Catholic faith?
You're like, breathing?
Breathing. You're breathing right now. We're just going to count.
Last time I checked.
We're going to count numbers while we breathe in and out.
Or say the rosary if you must make it spiritual.
Sure. But just immediate, rigid distrust.
Yeah, like they walk in on the defense.
Yes. Yeah. And at the end of the day, there are people who are of goodwill, willing to listen and willing to work hard, which is unfortunate for the former people we were talking about, because a lot of them, they're the ones who really do need the help.
Yeah.
And if they are a parent of a big family, these are the things that they're influencing their children about, which is often harmful.
Yeah.
Yeah.
I know. There's something about the very conservative Catholic world specifically that puts them on the defense against medicine. And on the defense against institutions, which is kind of ironic because of all the people, Christians in the world, that should accept an institution, it's Catholics, like that should be comfortable submitting to authority. And I think that is another big problem, is this aggressive stance against authority. Like, I don't really have authority in my life. There's nobody that knows more about this than I do. I know my body. Like, I am the expert in myself. And that carries through to the amount of division you see in submission to church leadership. And like, this is just a mindset we have, I think specifically in America, of like, I don't really need to ever submit to an authority. I get to make my decisions for myself. And it's like, no, that is actually not true. Right. God did not design the world that way.
Right. And it extends to universities as well.
Yeah.
I've had conversations and I've heard from certain pulpits that universities are just propaganda and not to be trusted, and that you don't need to go to university. It's to be avoided. It's worldly. You might lose the faith.
Wow.
Yes.
What are you supposed to do?
Be humble, not be worldly.
So just like work a low-paying job your whole life because...
Yeah.
I mean, not necessarily. You might do great when you're going to college.
But the problem is when you're then Catholic and open to life and you have 10 children and you're working a low-paying job while your wife is a stay-at-home mom, it becomes very hard to thrive.
Yeah, that's true. But that's a different topic for a different time. We'll talk about education. Maybe next week we'll get on to homeschooling.
Yeah, well, if you don't have money, you can't pay medical bills.
Yeah, that's true.
And so maybe...
Although you don't have to. Just file for financial aid from the hospital. They will pretty much always cover it.
Really?
Yeah. The amount of work they do that they're not paid for, it's wild. I mean, it's like maybe 30%. Like, it's really high.
Wow.
That's a number off the top of my head. But it is a little bit sickening. Like, I look at it every month. This is how much we billed. This is how much insurance covered. This is write-off.
Ooh.
Because people can't pay. Which, I mean, that's necessary. Our hospital bills are insane. So that's a flaw of the system. Again, the devil of insurance companies.
Yes.
That set the rates so high.
Yes, but I think it's easier to distrust the medical field, and it's easier not to interact with it if we have the excuse of, well, it's too expensive, or it's all propaganda. They don't know what they're talking about because I know my body. So it's just another excuse to withdraw from like medical authority.
Yeah, I can just pray over my child, and if God wants them to live. This happened to my mom. My mom, as a child, got appendicitis. And her parents just decided to bring in a missionary and pray for her. She was one of like 14. And she lived, but then later as an adult, she had this like crippling, horrible pain. And turned out her entire like gut was filled with like scar tissue from this like appendix rupture that she like basically barely lived through. So I suppose, like, technically the power of prayer worked, but I'm like, that's really bad parenting. Like, that, one, horrible suffering for her as a very small child. Two, intense suffering through, like, a large part of her adulthood. Because she, for years, she would always, like, make smoothies. Like, a lot of her meals were liquids. And I didn't really think about it. None of us did. But then she just told us later, like, well, it always kind of hurt when I ate, like, solid food. And we're like, wow. Oh, my gosh, you've been doing this for years and, like, never thought maybe it's not normal to not be able to eat solids. So anyway, yeah, she ended up having, like, emergency surgery, and they had to, like, explore and cut all the scar tissue out. But all that because as a child, her parents didn't just, like, bring her to the doctor when she was sick. Which I'm like, if you had brought her to the doctor, you wouldn't have had to pay the medical bill. You would have gotten it written off. Like, there's no way.
Wow, that poor child. Appendicitis is so scary and so painful.
So painful. I had it when I was pregnant. Yeah, it was terrible.
When you were pregnant? Oh my gosh. Yeah. Did you have to have surgery then? Like,
I got, they gave me antibiotics and it staved it off. But I kind of continued. I had like almost a chronic appendicitis where it would flare up some. And so I ended up just getting it out. Once I wasn't pregnant anymore.
Wow, you took antibiotics too.
I know. I just put my my child at risk.
Well, you wrecked your gut for the rest of your life.
It's true. The gut microbiome's never coming back.
No, it's stripped. It's leaky. It's done.
It's leaky. A leaky gut is another one of Andy's like greatest pet peeves in life. He's like, it's not leaking. This morning, he was getting a text from a patient. He's like, you would not believe how obsessed people are with their bowel movements. I was like, the people send him pictures. They're always convinced they have worms. There's some like weird natural health. Yes, they're like, everyone thinks they have worms. He's like, please stop sending me pictures of your poop. You do not have worms. Like, I cannot tell you enough.
Oh my goodness. Yeah, I have also heard this in the crunchy community a lot. Like, it's parasites, it's hormones. But I'm not going to take antibiotics. I'm not going to see a doctor because I know better, and I'll fix it with diet.
I'll just drink kombucha.
I'll just load up on the bone broth to fix my leaky gut.
Yes. Which isn't leaking. If you have a leaky gut, there is a true leaky gut, and it's super dangerous, and you're in the ER for sure.
You'd be like septic, wouldn't you?
Yeah, it's like really, really bad.
Okay.
You would know if your gut was leaking. It would be a big deal.
Maybe it's a misnomer then for what people are trying to describe.
I think it's like multi-level marketing companies trying to sell their dumb products.
More propaganda.
Yeah. Well, and it's like insane. These companies, it's like, oh my goodness, I started working out 3 days a week and I cut out all processed sugar and I feel so good. And it's like, well, duh. I mean, I'm not saying you shouldn't do those things. That's great. Do that. But it's not because you like healed your body in some way. It's because you just started making way better health choices.
Yeah. Yeah.
It's so frustrating.
I'm trying to think of, how to help Catholics, how to help people who have faith have a reasonable amount of trust in the medical field.
Yeah.
Because obviously we have our values and we have our boundaries, right? Where, you know, if I have a child with Down syndrome or with some kind of deformity and they, you know, will live naturally, I'm not going to get an abortion.
Yes.
Right? So we have that boundary is very clear. But it's curious to me why people are so afraid to interact with the medical system, even for like pretty low levels of care. And the church teaches that it is reasonable for us to care for the body.
Yes.
And it is reasonable to go to a certain point of care, even really intense care, surgery, you know, like...
Well, we talked about ectopic pregnancies. Like, if you have an ectopic pregnancy, what is it? You can remove the damaged part of the woman's body to preserve the woman, even if the, like, natural result of that is the death of the child, which is exactly an ectopic pregnancy is when embryo implants in a fallopian tube instead of in the uterus, and like both the mom will die if it's left unattended, and so you have to cut out either the whole fallopian tube or part of it.
Right, and so the intention there is to remove the damaged tissue. Yeah, and if the result is that the embryo is destroyed, that's allowed by the Catholic Church because that was not.
The intent wasn't to kill the child.
Right. The direct cause of the death of the child was not, like, the intention was not to go after the child. It was to go after the damaged tissue and to save the mother. Yeah. Right.
And these are things, I mean, there are, like, OB doctors in town here that are specifically Catholic doctors, and they operate in a very Catholic way. Like, I know if women are, like our church, at least go to an OB, that's pretty much the practice they all go to. There used to be a birth center in town that everyone liked, and it closed down. So,
what does birth center mean? Non-medical or? Yes,
I think a lot of these doctors maybe would go to the birth center. It's like a much more... Usually they're midwives. There's a lot. They don't like monitor you the whole time. It's not as regulated when you're giving birth. So a lot of people really prefer that. It's kind of like an in-between of a home birth and a hospital birth.
Mm-hmm. And are they able to, like, do a C-section if needed at a birthing center?
No, I think you would. Well, I don't think so. I think you would have to go to the hospital.
Okay. Okay, so you'd have to be transferred.
Yes.
Okay, well, that sounds very unpleasant whilst in the middle of labor. But,
yes.
Yeah, but I think the general distrust of medicine is an imbalance in general. It's normal to want to care for the body, to want to be well, to be strong, to be pain-free.
Yeah.
And that's where we can do our daily duty the best.
Yeah.
You know, a mom... like you, if you have a splitting headache, I imagine that if you take some Advil or some Excedrin migraine, that you're going to be your best self then.
Yeah.
As a mom, like doing all the things you need to do. Yeah. And I mean, for me, if I'm at work and I'm in pain or I'm ill, better believe I'm taking Dayquil or I'm taking an over-the-counter analgesic just to help me get through the rest of the day. To do my duty of state.
You have to do your job, yeah. I mean, I wonder, this might be pushing it a bit, but to me, a lot of it boils down to a sin of pride, because most of the time, this really radical anti-medicine is also combined with a radical kind of obsession with health. And so it's not only am I very internally focused and very obsessed with the state of my body, I'm also very prideful and unwilling to submit to any sort of authority in this area. That's a harsh statement, but I think if people really examined themselves, there would be a little more honesty about, like, you can be too, like, it can be vanity, you know, when you're constantly thinking about what you're putting in your body and how your body feels and constantly analyzing it. Like, that's not a good way to live. I mean, Scripture directly talks about that, actually. Like, don't worry about what to eat and what to wear and, you know, all these things. So there is a tendency, it seems like a sin to me, to get too extreme about it.
Okay. Yeah, that makes sense. I mean, if you're so worried about it and you're constantly focused on that, then that means you're not focused on other things that might also be really important.
Mm-hmm. Yeah, and to do all the naturopathic things is unbelievably time consuming.
Yeah. Yeah. And very expensive. I don't think naturopathic doctors take insurance, so that's out-of-pocket costs. Yeah, and on the psychological side of all of this, I've known a lot of crunchy people, especially women. Really, not a lot of men. A few, but women who they're always sick.
Yeah.
Something's always wrong, and then the conclusions that they draw about what's wrong with them, like, oh, my stomach is this. I was a little bit constipated. I had too much processed sugar. I need to cut out dairy. Oh no, I cheated and I had a fast food, like I had a burger. And then they're always sick. To me, I'm noticing, okay, how does this benefit you?
Yeah, that's what I was going to ask you. What is the obsession with being sick? Why does it feel good to be a patient?
Oh, yes. Yeah, so if you're always sick and you have a doting husband, maybe that's how you get attention.
Yeah.
Maybe if you are always in need of help, that's how you feel connected to your community or to your spouse. Or if your kid, if that's how you connect with your kids, like bring mother tea, bring me this. Oh, I need a nap. I need to rest. I always need to rest.
Uh-huh.
I think it can get really selfish.
Yeah.
Which maybe that's taking it too far on my side.
Yeah. Well, I mean, there are always extremes, and then there are people who are perfectly reasonable and actually have a chronic health disorder.
Yeah, but if you won't go to the doctor to get a proper diagnosis and you won't follow the medical advice, you just sit at home, self-diagnose, self-medicate with food, and then
which isn't even that effective. Try alcohol or Xanax.
Yeah, but then your whole life becomes very small, and you're benefiting. All of your attention is on yourself, and your spouse is constantly worried about you, and you get what you want. You get out of work.
Yeah, it gives you a reason not to push yourself.
Yeah, it gives you a reason like, well, I can't clean my own house. I can't care for my own children. I can't, what else? I can't do social activities.
I can't exercise.
No, I can't definitely not. But what I see is especially just the care of the household. Like, I'm incapable of doing the care of the household because I have an ambiguous, undiagnosed, untreated, random symptom that I'm figuring out on my own.
Yeah.
It infuriates me. You all have delusional disorder.
There you go, diagnosed. Delusional disorder.
Yeah, or let's see, conversion disorder, the malingering. There's a whole...
You don't need to be diagnosed with an autoimmune disease because you're diagnosed with mental health disease.
Right.
The autoimmune, everyone wants an autoimmune disease. It's the hottest disease to have.
Yeah, and it's the hormones and the parasites.
Of course.
With the autoimmune.
I wonder if there's... Okay, so I think about like the Black community in America, how there's this sort of historic distrust because they have been like actual experiments.
The Tzatziki?
Tuskegee.
Yes.
Syphilis study. Was it syphilis? Yeah. So that the Tuskegee syphilis study was they were pretending to treat Black men, and they weren't actually, because they just wanted to study the process of syphilis, which is obviously really horrible.
Intentionally affected people with syphilis.
Did they, or did they just not treat them? They pretended to treat them and not. Well, one of those. Anyway, I think they had some that they treated and some they didn't, but they told everyone they were treating them.
Okay. I'm not remembering exactly.
Regardless, it was super unethical. And and so the Black community doesn't necessarily trust medicine as much in general because there's sort of this historic problem. And I can wonder if there's some of that with women too, because there is a historic prevalence of doctors, like how many women had like terribly bad postpartum anxiety and were like just put in like homes. Like insane asylums and that kind of thing, where it's like, you might have just been a little depressed, but their husband's like, I just need a new wife. So he like shuffled her off to an insane asylum and like married someone else.
Right. I mean, T.S. Eliot's wife had terrible postpartum depression and maybe even postpartum psychosis, but we didn't have mood stabilizers back then. And she may have also had bipolar, but he was just miserable. They were miserable for years and years.
Yeah.
She eventually died and he remarried, but what a sad tale of the mistreatment of women in healthcare.
Yeah, or when women would be diagnosed with psychosis and the treatment was to stimulate them to completion, essentially.
Yep. Yeah.
That's weird.
That's unethical, immoral, sinful.
I mean, I don't think they thought of it that way. I think they thought it was a treatment, but
Like a treatment, yeah.
Yeah. I'm like, apparently no woman was ever having any sort of pleasure with her husband because she obviously didn't know they were connected at all, which is crazy.
Well, even in medical textbooks, like when I was pre-med, something like 15 years ago, there was very, very little information about the female reproductive system, especially the exterior portion of that and those tissues. So female research and information is still
the female body is a lot more complex than the male body. Like the reproductive system in particular
Absolutely.
is much more complex.
We have the metabolic weight on us. Yeah.
Which I think this is a reason why every single girl should be taught NFP. Like, I didn't understand my reproductive system at all until I was having trouble conceiving, and I had to study it. And then I was like, I went through health classes over and over again, and then I just turned it off. It's okay. And then I went through a degree in public health, and I didn't understand what ovulation was. Like, how is it possible that I didn't know what ovulation was after having a degree in public health? Like, anyway, I mean, I knew I didn't understand that you could only ovulate once a month, and there was only the short window. I think public schools should teach girls NFP instead of teaching them to get on birth control. I mean, or get an abortion.
Right. Yeah. A lot of contraceptive talk. I don't think abstinence is really taught in public schools.
I think it probably depends on the state. I think it is in Texas.
Okay.
Like really Republican states like that. But nobody is abstinent, so there's that.
Yeah.
Although actually nowadays they are. Kids are having less and less sex because they're all germophobic. That's the problem.
Really?
Well, I mean, okay, I'm diagnosing an entire generation. I think COVID, everyone became kind of weird and antisocial, and it like made people kind of germophobic. And so now we have a whole generation that mostly interacts online, and they're having less sex.
Yeah, I read a study recently for adults, sexually active adults, that this is the first generation of adults who are having less sex than any of our previous generations because we're doom scrolling instead.
Yeah, and watching pornography probably.
Oh, probably. But also just that dopamine hit from our phones all the time is more exciting than intimacy.
Yeah.
Which is really sad. Yeah,
it is really sad. Yeah, and you don't trust people or have friends. Okay. Well, I think we've about covered the broad topic. I'm sure we'll come back to this topic because we both care about it. But thank you so much for watching the Catholic Everywoman today. We would love to hear if you think this is a normal way of thinking or if you feel that we're being insane and extreme. Tell us in the comments.
See you next time.